Hi, I'm Edwina Griffin. Many people ask me how mind programming actually affects their health and happiness. Now, there's been many scientific research studies done over the past 50 years. Two people who've really influenced my work and my understanding of this have been Dr. Ellen Langer and Dr. Bruce Lipton. I had the pleasure of interviewing Dr. Ellen Langer, professor at Harvard University, last year, and she said to me, "Where the mind is, the body will follow." Dr. Ellen Langer has done over 200 studies on the mind-body connection, particularly around mindfulness. One of the studies she did in her counterclockwise study was with two groups of people, two groups of men that she had in an environment where one group was pretending they were living 20 years prior. So they had all the decor of 20 years prior. They were speaking as though they were 20 years younger. They were eating, conversations, everything was around being 20 years younger and being in that time. The other group were in the same location, but they're in the present time looking back. This study showed that after a week, those that were living and embodying as though they were 20 years younger and really thought that they were 20 years younger in all the ways they were thinking and reacting, had much higher levels of strength, memory, and some even looked younger after a week. That's one of many studies that Ellen Langer has done. Another person who I found very interesting and who's really shaped further study in epigenetics was Dr. Bruce Lipton. He's a cellular biologist who found that the reaction of our cells is determined by the environment which the cell is surrounded by. Now, the message to the cell is sent from our brain. Therefore, our perception of our environment will determine how the cell reacts. And his work in the biology of belief discusses how we determine our perception. Now, our perception is our belief systems and our thoughts, which is where the role for hypnosis and NLP work and mind programming work comes in. There's been more recent studies done. For example, Harvard University have also done studies around relaxation, where they've done a recent study on how when people relax. They had two groups, a group that's doing relaxation techniques around yoga and meditation, and another group who weren't doing any relaxation of yoga and meditation. Now, the group that was doing these relaxation techniques, it was found had much higher levels of genes that were disease fighting in their bodies that were activated. Those that were doing no relaxation had very low levels of the disease fighting DNA switched on. They then, as part of that study, got the group who weren't doing relaxation to start doing relaxation techniques of yoga and meditation. And they found after 2 months that those people in that control group started to have the DNA switch on for disease-fighting genes in their body. This shows that our ability to be able to turn on healthy DNA, switch on DNA on and off, which Bruce Lipton's work initially showed, at any point. Which is why I've brought this into the program for the 90-day evolution. This program is unique in that way. We're not just doing exercise, we're not just doing nutrition, we're not just doing hypnosis. There's many programs that do one of those things. We're actually doing all three, and this is a really important component for your program to get the results, because shifting your mindset will not only shift your actual mindset and you're feeling great, but it will shift the cellular biology of your body and enable better levels of health. So I encourage you to do the mindset work every week, and ideally 2 to 3 times a week. Now, if you have quite a stubborn thought process that you're trying to shift, I would recommend you do it more often. Or if you're just trying to shift something more subtly, then you may bring it back to whatever it is you need. I have worked with clients over the years and stopped people from smoking with hypnosis in one session, stopped people from drinking so much, enabled people to shift their eating habits, and also to reduce stress levels. So it's a really powerful work if you allow it to be so. Some people may not be able to be hypnotized, and some of the main reasons for people not to be hypnotized is their belief around whether or not it can work. So our belief systems in it really do have a big impact, and I encourage you to give it a shot and also be aware of neuroplasticity and all of the research around this work in our ability to change our thought patterns and to change our behaviors. You know, it takes a few weeks to change the patterning of muscles and enable our muscles to work efficiently in the same way that our brain and our thought patterns can be retrained. So enjoy the hypnotherapy, and again, remembering to do 2 or 3 times a week of the hypnotherapy relevant to you, and shift it depending on whatever's coming up for you.